Movement is medicine, but as a trainer, if you can't assess and address your clients' movement challenges, you're not going to be able to help them get stronger, improve their endurance, lose weight, or reach any of their goals. It's such an important thing. In this course, we not only give you exercises and routines that you can memorize and you can use with your clients, but most importantly, we show you the essential fundamental components that make those exercises and routines work. It's great to know that you can grab a stick and you can do stick passes and warm up the shoulders. But if you don't understand the 3-point stack, how to maintain it, how to isolate an area, all you have is an exercise that you can't apply efficiently. What we do is we show you those missing pieces that are going to help you actually use those exercises that you've seen all over the internet and maybe in other courses. These are the essential keystone movements and components that you've been missing. Here's a little example.
Hey guys, Sarah from Agatsu HQ, and I'm really excited to bring this mobility course to you. So here's a little sneak peek of what you can expect. We're going to talk about mobility in local terms of the joint, and then we're going to talk about mobility in global movements of multiple joint movements, so compound movements. A little breakdown of how we look at mobility. So mobility really is this tripod here. We have the actual range of motion that is available in the joint, all right? Then we have stability. That can affect range of motion. And then we have flexibility, which can also affect range of motion. So the first thing we're going to do is we're going to explore the range of motion. So follow along with me. Let's look at our shoulder. Okay, so let's look at the shoulder joint, the movements it's capable of. So this is our exploration component. So our shoulder is capable of protraction, elevation, retraction, depression, adduction, abduction, internal rotation, external rotation. That's a lot of things going on. So you can break them down simply just by going through the steps like that, or you can also add in the entire limb. So we can do one easy one that you might already seen. We're going to raise our palm here so we have external rotation. We're going to push forward for protraction. Let's make sure we don't pop our ribs, so we're paying attention to the range of motion the shoulder is capable of. We'll get to the apex here. I'm in elevation. Then I want to internally rotate. So I'm going to turn here and I'm going to get shoulder extension, retraction of the scapula, work into depression. So nice and easy. What is the shoulder joint capable of in this movement? Now, I don't want to get too complex, but we do want to pay attention to what's going on from one side to another and look for imbalances. So an imbalance can be range of motion, or it could be any pain we might feel or restriction, okay? So let's look at the other side. Nice and smooth and easy. Or you might see someone going further out on one side or having to bend their arm. That could be a restriction in the tissue. You might also see that someone has to compensate by popping the ribs. This is really common. So instead of coming overhead, what we do is we cheat outwards and we pop our ribs to come through. So that might be a stability issue. Follow along with me. Let's look at both of those. All right, if we want to correct some stalls in the ranges of motion that we're seeing, first we need to address stability in the spine. So we call it the 3-point stack. We have our jaw, our diaphragm, and pelvic floor. We want to bring awareness to those pieces. So the first thing I ask my client is to stand with feet about hip to shoulder distance apart and just be aware of how your rib cage moves. Place your other hand on your pelvis and be aware of just moving your pelvis. This is called disassociation. We're trying to bring awareness into one piece at a time. So hand on the diaphragm, hand on the pelvis, move only one at a time. Okay, and then I want them to find the point at which, if I had 2 levelers, that is to say if I was hanging 2 shelves, I would find the point at which my diaphragm and my pelvis would be parallel to each other. That helps us create better intra-abdominal pressure. There's another lesson on how to create this, but this is the base of what we need to do in our alignment. Once we've taught them 3-point stack awareness, we can start to address the shoulder a little bit more. So we saw on one side that we had great range of motion, and on the other side, it might have been out here more. They're not able to bring it as overhead as the other side. So what we're gonna do is we can use the floor or wall to help us, but they must maintain the 3-point stack. I'm going to gradually bring the joint into a new range of motion. I don't force things into new ranges of motion. So this is a little excerpt from our shoulder clock routine, okay? We'll be down on the floor. I urge my clients to keep one hand on their rib cage so they know they're not popping their ribs. All right, follow me here. So we're going to make sure we keep our 3-point stack. I'm gonna bring my hand just slightly above where the range of motion was available, trying to get more overhead, but for right now, let's just address this. We're gonna reach our hand nice and long. Remember, spread the fingers. It's part of this whole component, this whole pillar. You're gonna squeeze your glutes so you don't pop your ribs. Lift your legs, squeeze your glute, and we're gonna bring it over to one side. So we can come in and out here, just trying to open up that tissue nice and gradually, not forcing things. The main thing you need to remember is if your client can't breathe and they're doing all sorts of, this hurts, they're just forcing their nervous system to fight against what you're trying to do. So regress the movement to progress, all right? So maybe they need to bring their hand a little bit lower. So we go in and out about 10 times. It's about 30 seconds to 45 seconds just to get a nice tissue pre-stretch. And then we're gonna work something called PNF. So that means we're gonna be working our agonistic and antagonistic muscle groups. I'm gonna be pushing into the floor for 10 seconds and then lifting off with my antagonistic muscles to try and get those tissues to create some stability, all right? So we're here, we're gonna push into the floor, nice, easy. I tell them just 10 seconds at first and just go at a level 2. You don't have to push to level 100 right away. So pushing 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now we're gonna try and lift off. This can be very challenging, so you might have to unwind a little bit, and then we're gonna lift off. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. It's not easy. It might feel like the hardest workout you've ever done because you're also training your nervous system. Typically, we do 3 to 5 sets like this. So I'll let you guys give that a try. Okay, once we've done our preemptive stretches, that is to say working into new range of motion, addressing the flexibility of the tissue, the stability of our spine, we can start to bring it into more progressively loaded stretching. Again, this might just be a yoga block or a stick for some of your clients. So we're gonna try and get into the tri-lat area to stretch into there to get a better overhead position. It's gonna look like this. Let me demo it first and then I'm gonna break it down. Okay, that was fast and there's a lot going on. So first thing is I like to use something that is about their shoulder width, all right? Because this is going to help them get into a better overhead position. So if they're using a stick, make sure it's not too far out. Again, meet your client where it's at. If they really can't bring their arm up here, you know, start here and then you can start baby stepping their fingers in on the stick. Then we can start adding a little bit of weight. So maybe you put a plate on the stick or you start using a dumbbell. What I'm doing here is I'm maintaining my 3-point stack. So I don't pop my ribs as I go back, right? I come back, I keep my ribs down as I sit back. I'm gonna have my elbows on the box and I'm gonna be squeezing the object to keep my shoulder position. I have a 15-pound dumbbell here, so it's gonna preload and stretch that tissue. I bring it up, get my elbows nice and in position, preload as much as I can, so I bring the weight overhead, And then I'm gonna sit back, keeping my ribs tucked. So this would be a popped position. I won't be getting into my shoulders that way, into my overhead position. So once I stay here, I'm gonna stay here for a good 30 seconds to 1 minute, just stretching. And then I wanna PNF again. So I'm gonna push my elbows hard into the box for 10 seconds, and then I'm gonna try and sit back further for 10 seconds. Looks like this. Driving my elbows down, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then I'm going to try and sit back a little bit more. Get a better range of motion here without popping the ribs. Can wait for 10 seconds, and then we're going to do the whole thing again. Pressing down, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Sit back more. So you can repeat this 3 to 5 times. Give it a try. Okay, so once we've worked on a new range of motion, you always want to retest and reintegrate it back into the body. So we can go ahead and do the same test, keeping that nice 3-point stack, hand on the rib cage, moving through all ranges of motion, right? And you won't see that there is inches gained. The body doesn't work like that. But what you should see is an ease of movement. So if your client was out here and going, oh, to get around, maybe they're here and they're moving a little bit easier through, and you ask them to go slow, extend a little bit more, rotate and come through. So you should see ease of movement. Of course, this takes time and progressive programming. The next exercise I like to commonly do is just a kneeling windmill. This can be done again with the lightest weight possible. So I'm going to use a kettlebell, but your client might just be using a 1-pound weight. What's nice about this one is it's going to challenge our shoulder stability, right? That's our other component of great mobility. We want to have control over that range of motion. So we have our overhead position, and then as we come down, the shoulder is going to internally rotate, right? And then we come back up, and it externally rotates here. So we're moving through that sticking point that they had trouble with. Go light and go slow. You can safety clean up the bell. You can use 2 hands to press it. Always have your eye on the weight overhead. We're gonna come down, nice and smooth, and then come back up. So we can progressively make this more challenging by adding more weight or more depth. So instead of going to the side, maybe they rotate more, they go to the center, and then they come back up, challenging that range of motion even more. All right, guys, give it a try. Okay, here's what you can expect in this 3-day course. Day 1, we're gonna go through assessments. So that'll be local and global movements. Day 2, we're gonna focus on upper and lower body movements and how to incorporate those from exploration, refinement, into a coordinated compound movement. Day 3 is going to be spent on programming and testing. So that is to say, we pick up where we left off on day 2. You're going to be assessing each other because you should be able to fix yourself so you can fix a client. And then you're going to walk away as well with your own program for mobility and movement. So I hope you can join us, and I look forward to meeting you.